Hi ho, health seekers, Dr. Ambs here, and this is another episode of Ambs Jam, the channel that's dedicated to teaching you to be a master of your own health, wellness, and longevity. Today we're going to talk about metabolic syndrome and insulin resistance. What is it? It's a health crisis that's killing America, and it's estimated that about 34% of Americans have metabolic syndrome, which means of the 10 people watching this episode, 3 of you might have it. Look out. And insulin resistance even more common. Estimates 30 to upwards of 50% of Americans suffer from this. And it's the primary driver of a lot of the morbidity and mortality that I see in the hospital. It causes high blood pressure, cardiovascular events, strokes, heart attacks, dementia. They're even finding out cancer. And obviously, it's going to affect your wellness, your mood, and your longevity and your health span. So if you want to live and you want to live a good life, stay tuned because I'm about to teach you all about it. Metabolic syndrome is a cluster of bad health conditions that co-evolve together. The hallmarks are abdominal obesity, having a lot of fat on your stomach, and having a lot of visceral fat, a lot of fat next to the organs, deep in the abdominal cavity. That's bad. Another thing that you're going to see is high triglycerides, which is usually called bad cholesterol, and then low good cholesterol, which is the HDL. Another thing you're going to see is high blood pressure and also high fasting blood sugar, which is closely related to insulin resistance, which we're going to talk about separately. So why is metabolic syndrome bad? Like I said before, it leads to all the major poor health outcomes and mortality that we see in America: heart attacks, strokes, dementia, cancer, type 2 diabetes. So next we're going to talk about insulin resistance, which is closely related. So let's talk about insulin resistance. It's crucial that we understand this process and how it happens and how it basically destroys our metabolism. So how is it defined? You're going to have high blood sugar. Okay, you're going to have high blood insulin, hyperinsulinemia. And then finally, your whole metabolic system is going to start to run inefficiently. It's going to start to become deranged, okay? And this process is what drives the central adiposity, the fat belly, the visceral fat, the high blood sugar, the high blood pressure, and then all of the negative things that come along with that. So let's kind of take a deep dive into the pancreas and how it secretes insulin and how that works. The pancreas is an organ that sits deep in the abdominal cavity, and it has 2 different functions: an exocrine function and an endocrine function. The exocrine function actually shoots enzymes into the small intestine to help us break down proteins and fats. In this video, what we're primarily concerned with is the endocrine function of the pancreas, and the primary signaling hormone it uses is insulin. Okay, so when the pancreas senses there's been a load of food, a meal ingested, it will send insulin to muscle cells, liver, and adipose tissue, telling those tissues to uptake the glucose and do whatever those tissues do with that store of glucose. Okay, in the muscles, it's going to be turned into glycogen. In the liver, it's going to be turned into glycogen and fat. And in the adipose tissue, it's going to be turned primarily into fat. That's what adipose tissue does. Okay, so in order to understand insulin resistance, let's think about the lock and key analogy. In this analogy, insulin is going to be the key, and the receptors on the different tissue is going to be the lock. So after months or say years of eating an excessive amount of calories and then not recirculating those stored calories, i.e. not exercising and using the glycogen or fat storages that we've built up, those locks, okay, or the receptors on those tissue are going to get worn out, meaning that insulin key is going to have to drive into that lock so many times to open it up that it gets resistant to the key. It gets resistant to the insulin. So then your pancreas has to secrete more and more insulin in order to overcome that broken lock, to kind of jam the key in there and turn it. So in the meantime, we're building up more blood sugar in our bloodstream. And there's only so much the muscles can take. So where's it going to go? It's going to get stored as fat in the adipose tissue. And that's why you start to develop that central obesity, that visceral fat, because those fats are very metabolically active. So they're kind of saving you as best they can from having high levels of blood sugar, because high levels of blood sugar is toxic to the body. It starts to damage the small capillaries in the kidneys, the brain, the heart, etc., building up plaque. So your body has to store it somewhere. So it's going to go into the fat cells and it's going to go into the liver. And that's why you're going to get fatty liver disease, which is now the #1 leading cause of liver failure in Americans. It used to be drinking, which is a lot more fun way to get it, if we're being honest, although also terrible for you. And then that's why so many people are fat. It's because of this insulin resistance phenomenon. So what can we do to keep from getting metabolic syndrome and insulin resistance? Or if we have it, what can we do to reverse it? Well, one of the main things you can do is increase your muscle mass, increase your lean body mass. Muscle is basically an amazing way to get rid of excess glucose. And the more muscle you have, the more you can do that. And also resistance training exercise increases the number of GLUT4 glucose receptors at the surface of the muscle cells in the bloodstream, so you can get rid of more excess blood sugar. It also helps you have a higher baseline metabolism, so you'll just be burning more calories throughout the day, although that's a smaller effect. Obviously, eating healthy foods, eating a protein-forward diet. Try to get as much protein as you can. You want to get about 1 gram of protein per ideal body weight. So whatever weight you should be, let's say you're 250 pounds, but you really should weigh 180, well then eat 180 grams of protein a day. That's your target. Cardiovascular exercise, increase your fiber intake, and then just getting good sleep, managing your stress, and then eating a diet that has less calories than you burn in a day. That's going to help you lose weight. You want to have more lean body mass and less fat, especially central adiposity. And there's also medications like metformin, and then obviously the GLP-1s, your semaglutides, and all those that have been very popularized. So guys, main thing is diet and exercise. Eat whole foods. Don't eat processed foods. Processed foods are the devil. Every now and again it's fine. Live your life. There's no point in doing any of this if you're not enjoying your life. Why have the longest, most boring life ever, right? But be happy. You'll be happier and healthier if you can get this under control. Thank you so much, guys, for watching. If you found this video helpful, please hit the like button. Please hit subscribe. Please share this video with anyone you think could benefit from it. And if you're interested in more information or getting your blood work done, which is very important, check out ambsjam.com or email me at drambs@ambsjam.com. Thank you so much. I'll see you next time.